Welcome back to the Practice Pulse, where we explore the people, ideas, and systems shaping the future of healthcare, wellness, and private practice. I'm your host, Nancy Margrit, founder of OptimaPro AI, where we help healthcare and wellness businesses scale smarter using AI practically, while retaining the human touch. Today's conversation digs into something many of us feel but can't always articulate: why healthcare often feels inaccessible, transactional, and frustrating, and what alternatives actually exist. My guest is Harlon Pickett, founder of Eagle Care Health, who works at the intersection of healthcare access, direct primary care, and the system design. This is one of those episodes that may actually change how you think about healthcare entirely. Welcome to the Practice Pulse, Harlon, and thank you for taking the time to talk with us today.
Thank you so much, Nancy. It is truly an honor to be on the podcast with you about a subject, obviously, that's very near and dear to my heart.
Awesome. So if you don't mind, why don't you start us off by telling us a little bit about your background and what ultimately pushed you to build Eagle Care Health?
All right, great. I think everyone's got an origin story, right? There's something that got you to do something different. And in my case, I was part of the same traditional system. I was pandering insurance, as it were. I was a regular insurance agent that was talking about how wonderful the insurance plans that I was offering you were going to be. Made this mistake, though, of caring about my clients. I know that sounds funny, but if you care about someone, you care about your clients, and you're offering what you think is the very best thing for them because you're bought into that, when you realize it's not, when you see people struggling to find or to get access to healthcare, when you see people going bankrupt, even though you believe that you found them the very best solution, when you see people denied access to healthcare or denied services because the insurance company has dictated which healthcare services they should be getting and has kind of removed the physician from that, it should make you start asking questions. And it certainly made me start asking questions. What am I doing? And am I doing the best thing for my clients? The resounding answer, whenever I really looked into it, was no, I'm absolutely not doing the best thing for my clients. So if I'm not, then what options are there? What's going to give them better access to health care? Because Nancy, the truth is, and this is where we get this very convoluted sometimes, health insurance and health care are two very different things. But if you ask someone where they get their health care from, 9 out of 10 times, they're going to give you the name of their insurance company. And that's
so true.
just the way that we look at it in this country, is that that's where we get our health care from. They even put it in their name, right? United Health Care.
Mm-hmm.
Right. And when you think of that, why should an insurance company be in between you and your physician? And why should they get to dictate which services you get if your physician has decided what's best for you? You and your physician saw what the problem was, looked at the results of testing, and then said, this is a solution that is best for Nancy. And then the insurance company comes in and says, no, I don't think so. Let's do this instead. Or you don't even need that at all. Now, there is nothing wrong with having an advocate on your side to make sure that you're getting the proper treatment for what you have. But when, in many cases, things are just dismissed out of hand, which is what I was seeing, it made me start looking for another route. One of the other issues that happens here, and I saw too, is people were not given time with their primary care physician. It took forever to get in to see one. And then when you finally got to see one, you had 5 minutes with your doctor, maybe. You spent a whole lot more time in the waiting room.
That's
And
true.
there's got to be an answer to that. And that pathway led me eventually a number of years ago to find direct primary care. And Dr. Roger Muchagumbo in San Antonio, Texas, was the very first doctor that I knew that was opening that kind of practice. When he was talking to me about this, I could just feel that it was going to be revolutionary. And he wasn't the very first one in the country, but he was the very first one in San Antonio to start that a number of years ago. And it's really grown a lot since that time. I mean, it's grown hundreds of percentages across the country. But if you don't know what direct primary care is a membership fee-based service that you pay a monthly rate. And then it can be anywhere from $75 to $150, depending on the size panel that your physician has. If they're what's called a pure DPC, these doctors do not accept insurance. They only have a panel of a certain size, maybe 500 to 800 is the most. So that means that's the total amount of clients that they're going to see. If that practice fills up, most DPCs then will hire another physician to start taking more on the panel. They will not overburden themselves, or they'll just say, this is all I want. I don't even want to have another physician here. This is it. I'm going to keep my 600 and it's going to be my 600. And if I lose some, then I'll open up spaces. It really depends, once again, on the DPC. If you're looking for one, these are the kind of questions you should ask. What's the size of your panel? What are you going to do if you get more people that want to be here? Those are kind of some of the simple things that you would ask about that. But what it gives you is same day, next day access. It gets you back into having a relationship with your primary care physician. I can remember whenever I was a kid, my pediatrician retired when I was around 12 years old, I think, somewhere around in that age. And so I just moved to the family doctor, Dr. Moore. And I stayed with Dr. Moore well into my late 20s. And the reason I finally stopped seeing Dr. Moore is because that just happened to coincide with the, I worked for a big company back then. And all of a sudden we went to an HMO.
Mm,
And Dr. Moore was an old school physician that didn't accept insurance. Well, I can't go see him if he's not in my plan, right? This is just how my mentality was. So I stopped seeing this physician that knew me and knew my family all those years because he wasn't in my network. What a ridiculous reason to stop seeing your family physician, but
right.
that's what I chose to do.
Well,
I believe that
I think
my
a lot of
health
people do
suffered.
that.
Yeah. I believe my health suffered for that because it became very apparent after a very short period of time that I'm just not going to go to the doctor if I don't have a doctor on me saying I need to go to the doctor. And I kind of carried that into most of my life where I just wouldn't go unless I was sick. And I would go 10 years without seeing a
Wow.
physician and not doing the things that I needed to do. That was another eye opener for me and a huge thing of finding direct primary care, because whether I would do that or not is irrelevant, because all of a sudden my phone goes off and it's Dr. West telling me, hey, it's time for that blood work. And then I'll see you next week. Okay. Well, I guess I'm going to get blood work. And I really just did it yesterday because he's prodding me. You got to get this done. You got to get this
That's
done.
great.
That's what we
Yeah.
need, right?
Mm-hmm.
Men in particular, we're so stubborn and we don't want to go to the doctor. And I need someone, not my wife, because she's going to bug me about it all the time. Like, yeah, I'll do it. When the doctor texts you, you're like, oh, okay, I guess this is serious now because he's fixing to tell my wife I'm not going if I don't.
You don't want that to happen.
No, but it really is life changing, because once you get that relationship back with your physician, oh my gosh, we don't tell our doctors, I think, so many times because we don't feel like we have time, or they're not going to care, or they're just going to put me on another medication. But when you have that relationship and you start building that trust with your physician, it opens up a whole new world for you. Now you're willing to talk about things that maybe you weren't willing to talk about before. Maybe you're even willing to look internally at yourself and think about things that you haven't wanted to talk about. I mean, I know that I have found, whenever we were talking about what blood work to do, I just turned 59 here just a couple of months ago, and
Congratulations.
I made it to 59. But I was having a conversation with some other guys. Recently, I was on a panel at a conference where we were talking about men's health. And one of the big questions and one of the big topics is hormone replacement therapy, right? All
Mm-hmm.
of the stuff that has been out there for decades about hormone replacement therapy, both for men and for women, has all been a bunch of BS. None of it was based on reality. So people just came up with this stuff, threw it out there. And so people have suffered for years because their physician said, no, you don't get. For women, it was estrogen and those things. And for men, it was testosterone. You don't get those because it's going to cause other problems. And it's all been debunked. It's all BS. So we had this conversation. I would have never dreamed of having this conversation with my doctor because I don't have some of the traditional effects that would make people have that conversation. But he said,
Right.
you should probably get this checked out. You just turned 59. Let's just see where your levels are. Not saying we need to do
Mm,
anything, but why don't we just get them checked out? We're doing a blood draw anyway. Why not? But that's interesting because I just had this conversation on this panel where someone who was having these issues asked their doctor, around at the same age as me, 2 years younger than me, asked their doctor about this. And he goes, nah, we don't need to check that. Don't worry about it. And he's like, well, can I just do it? And he goes, no, I'm not going to write you an order for that. Why?
yeah.
Why? What is it hurting you, doc? You're not paying for it. Why would you tell me I don't need to have that tested? It bothers me when physicians won't take the time to even listen to their patients.
Mm-hmm.
And I just hear this more and more. This is what makes me so adamant about talking to people about, okay, you've got a health plan, great, but your physician doesn't have to be in the network. Get you a physician, get you a direct primary care doctor so that you have someone to really discuss these things with, have someone that you trust to have these conversations with. And this is men and women both.
Hmm.
And the good thing is because of how many there are around the country now, you can find one. If you want, if you want a man or you want a woman, you can do that. It's not just one sided. I know a lot of direct primary care doctors all across the country, from small towns in Louisiana all the way to big cities like Boston and
Right.
Houston.
So tell us a little bit, like you said, people hear healthcare, they assume insurance. How do you explain exactly what Eagle Care Health really does? Like, tell us exactly what it is you're doing and how it works within the system.
Yeah, that's a great question, because what we have really understood is that in most cases, the problem with access to healthcare is the insurance company themselves and the hoops that you have to jump through, whether it is the patient or whether it is the physician or the imaging or whatever it is that you need to get done, the things you have to do to get that, to get those approvals, to fight through denials. So we build health plans that are not necessarily traditional insurance. We work with nurse navigators. We work with a lot of independents. We work with direct primary care, as I mentioned. We build health plans that work very similar to insurance plans, but they empower you and your physician, the patient and the physician, to make good decisions and to be very fiduciary of your health care as well. When someone has an insurance card, so many times they treat that like it's just a blank credit card. I can just go, I know my amount is whatever my deductible is. It doesn't matter how much I spend. Once I've met that, I just can keep spending, spending, spending. Well, you may not think that that's having an impact, but that rate increase that you get next year, it's because you were using your card that way. And so were many, many other people that were on the plan. You know why your deductible went up next year on your group health plan? Because you were using your card that way.
Right.
It's a self-fulfilling prophecy of building these things up, and you continue to get higher premiums, you continue to get higher deductibles, but you continue to get worse access because they keep narrowing your network. All of a
Hmm.
sudden, instead of a PPO, you have an EPO, and then from an EPO, you have an HMO, and you're wondering why in the world my network keeps getting smaller. Well, it's all of these are ways that health plans themselves reduce their cost and push things back on to you as the consumer. But what we're doing is, in many cases, open networks where you can go to any physician you want. A lot of times you can go see those physicians for zero cost. Now, the reason for that is because we do use nurse navigation, and the nurse navigation is just not traditional nurse navigation, but it's nurse navigation with insights on quality and price. So these nurses are leading you and helping you. If you need to go see a neurologist, we're going to help you find a neurologist. How do people normally find one? They just get on the network of what they have, or they have their
Right.
primary care physician recommend one. Well, if you're in a traditional hospital network system, then you may or may not know this. Your primary care physician gets bonuses and extra pay if they refer you into to a specialist within that network. As we say in our
Mm.
industry, down the hall. If they send you down the hall, there's incentives for them to do that. Same thing with imaging, same thing with blood work, all of those things. If they send you down the hall, it helps them pay their bills. And primary care physicians in traditional systems are the lowest paid of everybody else. They are the main person that's going to help take care of you. And a lot of times they're not allowed to do their job, which is another reason for direct primary care. But by building your own health plan, you can help control your healthcare spend. You can also have better access to healthcare, and your medication costs come way down, both as an employer as an individual. Now, of course, there's this big push for GLP-1s. Everybody wants to be on Ozempic or Mounjaro or whatever.
Hmm.
And there's a lot of folks that simply can't afford those. There are alternatives. With Eagle Care, we actually offer alternatives where you can get a semaglutide, which is the same formulation, say, of Ozempic, for less than $100 a month. And
Wow.
yeah, I mean, we're talking about $800, $900,000 medication.
Yeah.
But as an employer, whenever you look at that, it also, if you're offering that medication to your employee for only $50 a month, as the copay, that doesn't change the price. The price is still, let's just say $8. So that means your employee's paying 50, but the employer is paying $7.50.
Mm-hmm.
So when you're able to, as the employer, offer these type of programs to your employees, that means your cost came down. Now, all of a sudden, I can offer it to my employee for zero cost because the overall cost is less than $100 to begin with. You're able to help that employee. This is attraction and retention as well. By having a customized plan that works for you as the employee and the employer, you're able to keep your employees, keep them happy, keep them healthier.
Mm-hmm.
It keeps them working for you. It helps with absenteeism. Once again, who's going to leave if they got the kind of health plan where almost all of your health care is zero cost and you have access to a doctor, at the snap of a finger, those type things.
Right.
These are all possible. Where they're not possible is in a traditional health plan. You just are not going to get that these days with a traditional health plan. Is it right for
This
everybody? Not necessarily. That's why, we have
right.
to have that conversation with someone, see what their population looks like.
Mm-hmm.
What are they dealing with as a population? I would say for most groups, it's a great option, but it's not for everybody. There's some groups that truly need to stay with traditional insurance plans. They just need to. That's a conversation we have individually. And I won't get too deep into why that is, but there are certainly some reasons um, revolving around the population health why someone would want to stay in a traditional plan instead of move off into a, a customized health plan.
Okay. Very interesting. Yeah, I used to, in a previous business, had several employees. I mostly do contractors now, but I used to have several employees and we, wanted to offer benefits. But as an employer, it sucks so much out of the amount of money you're able to provide your service for because you're paying so much for employee benefits and it doesn't often translate to the employee the benefit and how much you're paying for the benefits on top of their paid rate. So it's interesting to see like an alternative that's less burden on the employer, but you still can feel good about being able to offer something to your employees that helps them stay healthier. And like you said, one of the reasons we wanted to offer healthcare is you should be going to your checkups. You should be able to get the medical care that you need. It's going to help you as a person, and we value you as a person, and showing that to your employees is paramount as an employer to make sure that your employees feel valued. So that's great. So you mentioned kind of it's not for everyone. Some people it doesn't benefit. Who does benefit the most from this model?
I said it is a fit for almost everybody, but let me flip that around and give you really who it doesn't fit for. If you have
Okay.
severe issues, if you have someone currently in treatment for cancer, if you have someone who's a hemophiliac, if you have someone who's got major conditions, a continuity of care is huge. And if you switch health plans in any way, shape, or form in the middle of someone getting treatment, you are doing them a disservice. That's really what I mean, Nancy, when I say it's not for everyone.
Right.
It's not for someone who has employees or an employee that's in the middle of the fight for their life or in the middle of some serious things. Someone just had a child and it's premature and that baby's still in NICU. You don't switch health plans with a baby in NICU.
Right.
Someone's spouse just had a stroke and they're in the middle of rehab. You don't switch plans whenever someone's in the middle of rehab. That's why it's so difficult to say who it's for and who it's not, because you've got to look at that population. You've got to see what's going on with that group. And I mean, we have groups that are doing alternative things like this that have less than 5 employees. So
Wow.
it's also for any size group, in other words,
Yeah. That's
because
great.
access to healthcare is access to healthcare. And we're able to, because of the number of people, especially the small employers that we group together, kind of aggregate them all together, we're able to get some
Hmm.
incredible contracts as well. I'm in the San Antonio area, San Antonio, Texas, but we have a contract in San Antonio, Houston, and Austin, and some surrounding areas there with a group that's providing advanced primary care and urgent care for $86 a month for the whole family. Unlimited
Wow.
access in person and virtual for your entire family, $86 a month, no copays and no out of pocket for any services that happen in the facility or virtually. That includes, they've got x-ray machines in all of them. They can do stitches, durable medical equipment. If you go in there and you sprained your ankle and you need to leave with crutches, that's going to be included as part of it. Lots of lab work, even like a well woman exam is all
Hmm.
part of it. we see some of these small employers that simply, to your point earlier, they cannot afford to offer benefits, but they really want to. This has been revolutionary for folks in those situations because now they can offer the benefits that their employees are most likely to use.
Right.
Because the day-to-day things, it's access to healthcare, no out of pocket. There is no barrier by cost whenever you have no out of pocket to receive your regular day-to-day stuff and your preventative. A quick story on myself. My mom had colon cancer last year. She has had her
I'm sorry.
surgery everything went great. She was recovering in the hospital. I'm going to go see her. I'm just feeling a little off. If I wouldn't have had easy access to healthcare, I would have went and saw my mom. Instead,
Right.
I went and I had a COVID test because it didn't cost me anything. I could just run over about 4 miles to the closest clinic.
Mm-hmm.
I was positive for COVID.
Wow.
So instead, I called my mom and said, I love you, Mom, but I love you so much, I'm not coming to see you.
That's true love.
It is because it's so weird. As I go through that mental process of myself, thinking I know better, but if I wouldn't have had the ease of this, I would have went and saw her.
Right.
But I went, in 10 minutes, I knew that I really didn't have any bad symptoms, but what if I
Right.
would have taken it to her,
Yeah.
recovering from cancer surgery? So these little things like that you may, let's rub some dirt on it and not worry about it, or let's just see how I
Right.
feel in a couple of days. Why? Why? Go get it taken care of. This is what direct primary care, advanced primary care, this is what these things offer to you. When you have access to health care, you stop putting things off. That is, putting health care off is at an epidemic level in this country. And it's one of the main reasons why we have such a horrible problem with chronic diseases, because people just keep putting things off and they don't realize what's going on with them until it's already bloomed into a
Right.
big full-fledged thing. This is another huge issue that employers have. You have no claim, no claim, no claim, big claim. Why?
Right.
Because your employees were not getting regular everyday health care until it got bad.
Which is really preventative care, having those tests ahead of time. And it's like these direct primary care doctors are able to go in and say, we need to take these steps at this age to make sure that we don't need to do something to address something preventatively. So I think that's a great way to really circumvent the issues around the current healthcare situation.
Yeah. I want to tell you one more little thing here. This
Yeah,
is
go ahead.
when we came into a church here in San Antonio last year, and one of their members had some pretty severe issues with diabetes. They were definitely overweight. They were not taking care of themselves the way they wanted to. The plan that they were on, they couldn't afford to get their insulin because it was too expensive. So they just weren't doing what they needed to. I mean, this person was really close to starting to have issues where they were going to have amputations and things like that.
Wow.
Part of that plan, of course, was direct primary care. And it just happens to be my same doctor that I see is who was the doctor for this group. He got intent on this guy. There's some people you really got to prod, right? And he was
Mhm.
one. So my wife went to visit that location yesterday and saw this gentleman. And when she got home yesterday, she said, "Oh my God, he looked fantastic. You would not even have recognized what he looked like. He's lost weight. There's just a glow about him. He doesn't look defeated. He looks
That's great.
fantastic." She couldn't get over the change. She said she hardly recognized him at first. She
Wow.
couldn't get over the change. But this is what access to healthcare can do for someone. And it's what it can do to the employees for a group. It's what it can do to you as an individual. When you have access to healthcare and someone that you trust with your healthcare, it can make that dramatic a change in your life.
So I love all of this, but tell me a little bit about could someone who's just an individual, not with an employer, could they access your services as well?
Absolutely. Yeah. Through
Okay.
Eagle Care, we offer individuals just as well. But, you also, if you want to find a direct primary care doctor in your area, I highly recommend you do that too. We certainly can help facilitate that. But maybe you just want to go out and find one on your own. There's a few places you can go to look at that. One of them is DPC Frontier. So that's a website, dpcfrontier.com. They have a mapper out there where you can go and check out DPCs that are around you. There's one called Next Era Healthcare, and Next Era you can actually find them on DPC Mapper as well, or DPC Frontier. But They're all over the country. As an employer, you can access Hint Health. Hint Connect is also shows DPCs around the country. But if you just want help, I mean, you can reach out to us. You can go out to eaglecarehealth.com and say, hey, can you help me find a DPC? Absolutely, we'll help you find a DPC. We believe in this movement so much that we just want to help people get access to healthcare. That is our mantra on everything.
That's wonderful. So you're in Texas. Do you do contracts outside of Texas, or are you solely in Texas? You're
Absolutely.
nationwide?
Absolutely.
Awesome.
We are
Okay.
nationwide. We're certainly nationwide. We use some of the same services that
Very
I
cool.
just told you. We find people DPCs, and yeah, we'll even give you the advice on, as I kind of mentioned earlier, some questions you may want to ask. We recommend that you interview your DPC before you
Mhm.
choose one. All of them will be open for it. I promise you, they'll all be open for it. They got out of the traditional health system because they didn't have time to do that before. But now,
Right.
I mean, they want to make sure that you guys are a good match for each other. Maybe you're not, and
Right.
that's okay. Then you find one that is, because that's what it's all about. It's still, if there's a barrier to healthcare because you just don't, as we say in Texas, you just don't g-haul. In other words, if you don't get along, if you're not on the same wavelength there, then it's not going to do you any good. Now you're paying for a service you're not going to use because you just don't have a connection with your doctor, and that's not what we
Right.
want. You need to have that connection. That's what's going to build that relationship and that trust.
Right. You want to build that connection again. Okay, so you've previously said that your work is not insurance dependent, it's insurance adjacent. Can you tell us a little bit about, is there a place or a role for regular traditional insurance in addition to what you provide, or are you a one-stop shop where you don't need any additional insurance?
Yeah, that's a good question. Once again, it kind of depends on the situation. We actually
Right.
have a lot of clients on the individual side that have marketplace plans. They have an ACA marketplace plan. The problem is they have to wait 6 months to see a doctor. And so we introduce them to either if they're, in Houston, San Antonio, Austin, we introduce them to the program that we have here, the Eagle Prime series, or else if they need a direct primary care doctor, we've helped a number of people in Florida find direct primary care physicians there because they have some of the same issues, long waits to see physicians.
Right.
But remember, a direct primary care, and even what we're offering on our Prime series for individuals, that's your day-to-day needs. That's not going to help you if you're hospitalized or you have something catastrophic. So there is a place we offer those too. By the way, in our consulting practice, we offer ACA plans if that's the right fit for you. We even offer that to employers. There are times when, as an employer, you're better off not offering a health plan, but better off offering DPC memberships and letting your employees themselves or helping facilitate access to the marketplace, especially in lower paying, not high income, where they still qualify for a tax
Right.
credit. It makes more sense for everybody involved. And we can show employers what that looks like as well. We just helped actually, funny enough, a healthcare group out of Houston that their size puts them underneath they don't have to provide a health plan because they're under 50 employees. And because of that, it makes more sense for some of their folks to be on ACA plans. That's where they're
Mhm.
already at. So many of them were already there. Well, why are we going to move them off of that? Anyway, it can be structured many, many different ways, and it opens up just so many options for the employees. But what they saw is the fact that they could give access to all their employees to the day-to-days. So they did the primary care membership for everybody. They paid for everybody to have that. And
Wow.
I mean, they're heroes to their people because of
Yeah,
that.
yeah. And it sounds like you're really a wonderful resource for people and for companies that want to explore alternative options that may be grossly more beneficial to the people that need the care that you're helping connect them with, you know? That's awesome. Let's shift a little bit to some of your business stuff. A lot of our audience are business owners, they're clinicians, they're, running their own practices. So let's talk a little bit about your systems. As Eagle Care Health has grown, what systems or processes do you feel are like the most critical to keep things running smoothly? Is it like onboarding, physician coordination, education? I know you talked a lot about your nurse guided system that you use. What system is kind of your core? Like, this is what we have to have. What works best for us?
Yeah. First of all, our relationship with the physicians we work with is paramount. If we don't have a good relationship with them, then it's going to break down as well. But once that's established, and really That's very difficult, but very easy at the same time. If they're open to working with us, then we're going to certainly work with them in whatever way they want to. Now, the next part of this is there's nothing is going to happen if the patients don't go see the doctor. And there's nothing that's going to happen if the patients don't even know who their doctor is. And there's nothing that's going to happen if the patients don't understand the services that doctor offers. So engagement with our members is number one. It's got to be out there. We've got to have a relationship with them as well. We've got to engage with them. We've got to make sure they understand what their benefits look like. If the employer has spent money on an employee to have benefits and the employee doesn't know they have those benefits, it's no benefit to anybody. The employee spending
Right.
money. It's so crazy to me how many times over my career I've had someone reach out to me, an employee, as it were, reach out to me and say, "Hey, next year, do you think we could add this?" Well, you've got it now. Wait, what? Yeah, you've had this ever since you came on to work here a year and a half ago. Well, why didn't anyone tell me? Why didn't you open your email? But that being said, we see so many times now that people don't open their email. So you've got to
Right.
have a multi-pronged attack. Text works a whole lot better these days than email
For
does,
sure.
but it's also got to come from other places. This is why our relationship with the doctors is so important. While we're pushing it to you from Eagle Care, we need your physician to be pushing it to you from them as well. So when that practice is pushing it out to you, it's coming. And the employer, if we can get the employer bought in, which most HRs are really good about this, they want to as
Right.
well. So now they're getting it from Eagle Care. Now they're getting it from their practice. Now they're getting it from their employer. It's multi-pronged attack, as it were, to make sure they understand what they have. That engagement, that's what changes the game. And it can't be the same exact way. I mentioned that panel I was on. One of the things that doesn't work when you're trying to talk to a guy is the same
Mhm.
thing that works that talks to a gal.
Mhm.
We need you to tell us something that makes us stop and look, oh, wow, okay. Yeah, maybe I should do that. But if you just send these canned, basic, it's not telling me anything, it's not really directed at anybody, it just doesn't work. These are why emails don't get looked at. This is why texts just get, oh, no, nothing, just get out of here, keep going. Push notifications, any of those things just get dismissed if you don't have a little more engagement.
Mhm.
We've tried all kinds of things too over the years. It's funny. We would onboard and then we would call every single member, a follow up and call every single member. You don't get a hold of anybody, right? You get
Yeah.
5% of the people and you just leave a voicemail. So what did it do any good, or did it just cost our frustration on for the person that
Right.
we're paying to do that? So it is funny, but text is today. Today's answer is text. I don't know
Mhm.
what tomorrow's is going to be, but today's answer is
Right.
text. And it really doesn't matter the age, which is kind of funny.
But yeah, I think everybody has really moved to text. The only thing I see with age is the much older people refer to a text message as an email erroneously, but that's the only thing I see. They're all texting.
That's
So
okay. That's okay.
yeah, call it whatever you want to call it. It's the text
Right.
messages are
Right.
getting through.
Exactly. Yeah. I'm perfectly happy if they got my email on their phone.
Right.
But really,
Yeah.
answer to
So
your question is that is what the biggest deal is. We've got to have engagement, both from the
mhm.
physician and from the member and with Eagle Care. If we can build that synergy between the three of us, it's going to be successful. And of course, the nurse
Right.
navigator is helping that as well whenever someone needs help. And, I'd be remiss if I didn't talk about this part of it. AI is becoming a bigger part of that as well.
Mhm.
And, we're integrating that into more things that we do where someone can just pick up, they can get that text, they can hit that link, and they can ask that question. Hey, I need to have my colonoscopy done. What do I do?
Mm.
And it tells them, quite honestly, in that case, it's a call the nurse.
Right.
But maybe they have a more complex question.
Right.
How much have I paid towards my deductible this year? Okay. It can do that.
It can answer that.
It can find that information and tell you by looking at the plan information that's right there in your app. So there's a lot that can be done with everyone's kind of scared of it in my generation, right? Because we all watch Terminator. And so it's all we think of is Skynet, man. But I'm beginning to embrace it a little bit more. I mean, hopefully we'll have some fun with it before the machines take over and kill us all. But that's okay. Well, we'll see how it works out. If it's going to improve people's access to healthcare, at least they'll go down healthy.
That's right. There you go. Oh, that's all we can ask for. A friend of mine, Dr. Kinford, he used to always say when he would do seminars, he would say, our goal is not to be happy and then decline. Our goal is to be happy, 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 dead. And that's the goal, right?
Yeah, that's right.
And I think that's what we're doing with all of the innovations in healthcare options like you're providing and direct primary care physicians and the preventative, really on the preventative side of helping people find how longevity looks for them and how it can help them have more quality out of their years, not just more years to their life, but quality in the years that they have left. So I love what you're doing with us. It's great. Where in your systems, as you've been growing, where do you still see friction? Where are areas that could work better, that could help you scale better?
No, that is the $64,000 question for those of you who are old enough to remember that show. It is still, what do you mean I don't have an insurance card? What do you mean it doesn't, or I have one, but I don't recognize anything that's on there? Where's the logos that I'm used to seeing? If I don't have those logos on my card, then this must be terrible insurance, must be a terrible plan. I can't believe my employer did this to me. Why do I have to call a nurse? I don't want to call a nurse. I just want to go to whatever doctor I want to. Great.
Right.
Who do you want to go to? Well, I don't know, but you don't want to call the nurse and make sure that you're guided to a high quality, great outcome physician. You want to pick that on your own. Really? Are you sure you do? But that's the friction. People want to be able to go wherever they want to go, but they don't know where to go.
Right.
So it's just a mindset that people have that they feel like if I don't have all the choices that I want and I can't just choose all on my own, then it must not be any good.
Right.
All we're going to do is send you to high quality, good outcome physicians. The reason why the neurologist that you went to before is not on there is because their score was a 5 out of 100. We're going to send you to a 92. And we've got the data to back it up. That's the thing is why you want to go to that hospital that's close to your house. I'm not saying you can't, but if you've looked anytime recently at the Leapfrog scores that they have and their CMS scores, you'll see that they got a D. You want to go to the hospital that got a D and has very high mortality rates, or you want to go to the one across town that we're recommending to you. And here's the interesting thing. You're going to see the same doc. See, this doctor's scores are terrible at this hospital and they're outstanding over here. What does that tell you? And this is true things that happen, Nancy. What does that tell you? It's not the doctor. It's the facility itself. And you dig a little deeper and you find out that this one over here that's got a D has terrible infection rates, high accidental death rates. They have all of these things that are going against them, where the one on the other side of town has lower overhead. They're running it very streamlined. They're very clean. They have very low infection rates, very low accidental death rates. All of these things run better because the management at this one over here is superior to the one over here. The crazy thing is there's many times they're in the same exact health system.
Wow.
I mean, it doesn't even make sense, right? Doesn't even make sense.
Yeah. Wow. Crazy. So Harlon, before we sign off here, what advice would you give to founders, practice owners, or physicians that are considering some of these alternative care models?
Yeah. If you are a physician right now and you find yourself with burnout, you find yourself just overwhelmed with the traditional system, you find yourself now the employee of a insurance company, which now the largest employer of insurance country is United Healthcare. I don't know if you knew that, Nancy, but United Healthcare employs more physicians than anybody else, any hospital system, anything. If you find yourself in one of these situations and you are very unhappy with that, you should seriously consider looking at joining the movement of direct primary care. Some people also call it concierge, but concierge in my mind is a different thing because that's executive medicine. To me, DPC is bringing it downstream to us common folk, as it were. And that's where it needs to be. Executives don't deserve any better health care because they have more money than
100%.
the guy that's making less than $50,000 supporting his family of four. And that's what DPC is doing. They're bringing you the opportunity to practice medicine the way that you dreamed you would be when you were in medical school. I know people who are specialists out there and making big money, and they got so beat up by that, they came back to primary care because they love those relationships. They love helping people, and you get to see that, and you get to practice medicine to the full extent of your training and full extent of your license. Whereas you don't get to do that into the system anymore. Your job is a gatekeeper and just to refer and refer, refer, refer.
Yeah.
It's a wonderful thing. If you are a physician and you would like more information about that, yeah, reach out to us and I'll be happy to refer you over to some of the folks that I know are helping people make that transition. There's a whole community that is helping folks make that transition and move over and come over to the light side and away from the dark side, as it were.
Come to the light side. Well, Harlan, this has been an eye-opening conversation. I really appreciate how you clearly explain the system and the alternatives. So one more time, where can people find you? What's your website?
Yeah, so you can go out to eaglecarehealth.com. That's eaglecarehealth.com. You can also find me on LinkedIn. Come and check out all the crazy things that
Awesome.
I do. I'll be starting up my series. We had talked about this a little bit, Nancy. I'm going to be
Yeah,
starting up
tell us
my
tell
podcast.
us a little bit about your podcast.
Yeah, my podcast series will be starting back up in March. It's called Why Does Healthcare Suck? And it talks about why does healthcare suck? This is the United States of America, baby. We should have the number one healthcare system in the world. And guess what we do? The number one most costly healthcare system in the world. That's right. We spend more money than anybody else, and it's not even close.
Yeah.
And our longevity, what are we getting for our money? We're ranked number 49 in the world. So our lifespans are short. Our expenses are high. We are not getting what we pay for. So
Well,
why does
what
healthcare
is
suck? We're going to jump into all things. I've almost completely committed myself for this first one to be back on hormone replacement, because that's kind of a big deal to me right now. It's been talked about. There was a women's health panel at that same conference. My wife was actually on that one. And a big
Awesome.
thing that was talked about was the taboo of you can't have hormone replacement therapy. And once again, all that has been debunked, but there's still many, many people and physicians that actually believe that is true, that you shouldn't have hormone replacement therapy, even though it, once again, it's completely been wiped
Right.
out. So I'm pretty sure that's what was going to be our first subject. And I'll have some clinicians on there to talk about that as well. But that'll be across
Awesome.
all the different platforms whenever it finally comes out.
Okay, awesome. Well, we will check that out when you launch that. So we'll link everything that Harlan mentioned in the show notes. And I want to thank you again, Harlan, for joining us on the Practice Pulse. It's been a pleasure. If this conversation got you thinking differently, don't forget to like, subscribe, and share. Each episode is designed to bring you cutting-edge insights in healthcare, wellness, and longevity, helping you stay relevant, scale intelligently, and elevate the level of care that you provide. I'll see you on the next episode.